Hey guys, Dr. Shivaam here, and starting with highlighting stuff part 26, I would like to say you something that there may be people who are more talented than you, but do you know that there is no excuse for anyone to work harder than you? So basically what I want to tell you is that hard work do beats talent. So make your hard work, make your extra effort to do the hard work, stay positive, work hard and make it happen. Make this thing happen. Get your desired PG seat or whatever you are dreaming of. Make it happen. Start doing your hard work with a positive mindset. Now enough with motivation, let's start with something useful, that is the lipoprotein and triglyceride thing from your biochemistry section. Now to simplify it, you should know something about these APO A1, APO A2, C1, C2, C3. So total what they ask is which enzyme these inhibit and which enzyme they activate. So I will tell you a easy method to remember this. Now you just remember it that ApoA1 is the activator of LCAT, that is lecithin cholesterol acyl transferase. Now what does ApoA2 and C3 do? Now ApoA2 and C3 inhibit lipoprotein lipase. Now if lipoprotein lipase is getting inhibited, it should also be getting activated by someone. So who does it? So APO, C2 and C3 activate this lipoprotein lipase. Now if someone like APO, C2 and C3 is activating someone, now they should also inhibit someone. So APO, C2 and C3 inhibit CETP. So summarizing them all, ApoA1 is the activator of LCAT. ApoA2 and C3 inhibit lipoprotein lipase. Now lipoprotein lipase is getting activated by C2 and C3. Now C2 and C3 are activating lipoprotein lipase but are inhibiting CETP. Okay, so this forms the gist of these apoprotein. CETP is cholesterol ester transfer protein. So this forms the gist, and just repeat this thing if you want to see it again, want to make it go into your brain. Now something, ApoE is arginine rich lipoprotein. E4 binds avidly to beta amyloid in neuritic plaques of Alzheimer's disease. So this is something applied in Alzheimer's disease. E4 binds with beta amyloid. Apoprotein for chylomicrons is only ApoB48. Common apoprotein for VLDL, LDL, IDL is ApoB100. So for LDL it is ApoB100 if asked. Now ApoA shows structural homologies to plasminogen. Okay, cholesterol ratio, which should be ideal, 3.5:1 for total cholesterol is to HDL. Now you see one classification of different hypolipoproteinemia. This is called the Federick's classification. What happens in them is, you should go into detail of each type. I will summarize it by telling you something important from it, that triglycerides are normal only in type 2 hypolipoproteinemia, while cholesterol is increased only in type 2 and 3. Both cholesterol and triglycerides are increased in type 3. So this is something important. Just revise this hypolipoproteinemia and the enzyme deficient and the things happening in them. Now there is something called A beta lipoproteinemia, where early death can be avoided by using fat soluble vitamin, especially vitamin E, in Tangiers and fish eye disease. So can you comment in the section what is Tangiers disease, what happens in it? So there is low or near absence of HDL. So what happens is, we see orange tonsils in Tangiers disease. Now enough with biochemistry, let us revise something important and something else rather than biochemistry. I'll give other things in another video. So just to change your mind, something important in this is the source of bleeding. Sometimes they ask some of these questions, like in subdural hemorrhage, you see bleeding from which veins or vessels? So it is from bridging veins. In duodenal, gastroduodenal artery. In extradural hemorrhage it is middle meningeal. So in extradural it is middle meningeal, in subdural it is bridging veins. In hemoptysis and bronchiectasis you see bleeding from an artery, and that is bronchial artery. In blunt eye injury or tennis ball injury, this is something peculiar called circulus iridis major artery. In retropubic prostatectomy, there is bleeding from dorsal venous plexus. In menstruation, it is from spiral arteries. In hysterectomy, internal iliac arteries. In anterior epistaxis, Kisselbeck's plexus, and in posterior epistaxis, Woodruff's plexus due to hypertension or something, means not due to trauma. Okay, so I'll finish this video here. Wishing you all the very best. This is Dr. Shivaam signing off, and thank you all very much.